Everyone thinks American healthcare is expensive because doctors charge too much. They're wrong. The real culprit hides 3 layers deep, and here's the trick. Each layer has a reason, but none of them are what we blame. Let's follow the cash from your insurance premium to the pharmacy counter and see where it actually goes. We're talking about a system that spent over $4 trillion last year. That's not a rounding error, that's a deliberate architecture. First, the obvious layer, insurance. You pay a premium, your employer pays a premium. The insurance company collects it all, then negotiates rates with hospitals and doctors. Sounds efficient, right? Except the negotiation itself, the administrative overhead of maintaining networks, processing claims, reviewing denials, costs roughly 8% of every premium dollar. That's the machinery grinding just to move money around. Then there's the hospital bill itself. A single MRI scan costs $2,000 in the US. In Canada, $600. Same machine, same radiologist skill level. And here's the trick. American hospitals don't just charge for the scan. They charge for the building, the staff who didn't touch you, the equipment that sits idle, and the cost of negotiating with 40 different insurance plans simultaneously. That redundancy is baked into every line item. But the deepest layer, the one that actually explains the price gap, is pharmaceutical development. A new drug costs roughly $2 to $3 billion to bring to market. That includes failed trials, FDA review, manufacturing setup. Nowhere else in the world do prices reflect that full cost. America does, because we're the only market large enough to sustain it. And here's the mechanism. Drug companies price high in the US to fund research globally. So when you see a medication cost 10 times more here than abroad, you're not just paying for the pill. You're funding the next decade of research. That's not a justification, it's an explanation. The system is expensive because it's built to be. Insurance, overhead, hospital redundancy, and R&D amortization aren't bugs. They're features of how we've chosen to organize medicine. The implication is stark. You can't lower costs without dismantling one of those 3 pillars. Reduce administrative overhead and you lose negotiating power. Reduce hospital redundancy and you lose capacity during surges. Reduce drug prices and you fund less research. Every solution has a trade. That's the actual choice we're making, not whether to fix healthcare, but which cost we're willing to pay instead. This video is for educational and informational purposes only and is not financial advice. Always do your own research. Subscribe to follow the money on every system you use, because the real story is always in the cash flow. This video is for educational and informational purposes only and is not financial advice. Always do your own research.